guys, welcome back to another episode of Nursing with Ingrid. Thank you so very much for stopping by yet once again. I absolutely appreciate you coming back to the channel. I'd also at this point like to say thank you very much to all my new subscribers. Welcome, welcome, welcome. Let's continue this growing this family, and also I would really like to get your input on what you'd like me to discuss and what you don't want me to discuss, so that it can be more fruitful and it will be more beneficial for you. Please like, share and subscribe. It's the safe way and the easiest way and the cheapest way that you can help me out and help the channel out. Going forward, I would just like to discuss today, as you can see by the topic of this video, I'm going to tell you things that I love and I would do all day, every day, 7 days a week. I love theater. I will always love theater, and I'll tell you the reasons why I absolutely love theater. But let's just get on with my reasons for liking theater. Theater is nice because you interact with your patient now, here. You go into theater, you do the procedure, patient goes to the recovery room, where the recovery room nurses will take care of business as usual, and you get ready for the next patient. So for me, I like that dynamic of that change that happens all the time. Yes, it may be the very same procedure that you're doing 6 times in a day, but no 2 patients are the same. You'll get a thin patient, you'll get an adult patient, you'll get a pediatric patient, but essentially you're doing the same procedure but not on the same patient. And for me, that is what gives it that little bit of excitement, if I can put it that way. The thing that I like about theater is that that is the only department, if you think about it properly, that is the only department in the whole hospital that will always have stock, that will always have equipment, that will always have any kind of resources you need, whether it be basic stuff or whether it's advanced stuff. At the end of the day, theater is the only environment where there's always stock. If there isn't stock, you've got an alternative, and a reasonably safe alternative to use. That is the only department that has that, in my opinion, at least. Let me say that. Coming to that, we know that in theater everything has to be sterilized. You've got to have linen. You've got to have water. You've got to have water. The rest of the hospital can function without water for a few minutes or half an hour, but we continuously have to have water. We have to have electricity. We need to have a backup plan. We need the AC. If there's no AC, there is no theater. So those are the things that I like about theater, and those are the things that make theater what it is and sets it apart from other departments where you can just shut down, you can open windows if your aircon's not working, if you are in the wards. But in theater, no. Aircon is running 24/7. Another thing that I like about theater is the scrub suits. Guys, I love looking good for work. Those that know me know exactly what I'm talking about. I love scrub suits because scrub suits give you that sense of individuality. It gives you that sense of adventure. It gives you that sense of creativity where you can distinguish yourself from the rest. If you like wearing the hospital provided scrub suits, that's fine. There's nothing wrong with that. But personally, I have my own scrub suits. I've actually got a whole cupboard full of scrub suits, from your basic scrub suits to your flamboyant purple, pink, colorful butterflies, you name it. I've got them all. It depends on my mood for that day and how I'm feeling when I'm going to work. And if I feel like being flamboyant, then I will wear my purple or my pinks or whatever the case may be. If I'm just feeling okay, then I'll wear the blues and the natural colors, the muted colors. So for me, I love scrub suits. Now, when it comes to scrub suits as well, this is the one part that I would like to stress to anybody that works in a theater or anybody that wears a scrub suit per se. You've got to wear your scrub suit once only. Please please, your headgear and your scarf, you've got to only wear it once because of infection prevention and control. We all know this, but unfortunately there's some nurses that don't really do that, and there are some doctors that also don't do that. So please guys, if you are in theater, please wear a new scrub suit every day. Going even further, as a sales representative, if you are in the surgical devices part of medical repping, which I was in, then you are moving from hospital to hospital doing different cases, supporting different cases. If that's the case, if you've got 3 different hospitals you're visiting for the day, you've got to have 3 scrub suits in your car. That's it. No questions asked, nothing of that sort, because you do not want to transfer microorganisms from one hospital, from one theater to another, and that's where we end up with these exacerbated infections and microorganisms that become resistant to drugs and stuff like that. It's because we, as the people that are coming in and out, it's the doctors that come here and they go there and they go there. You'll see some doctors, and it horrifies me, that they're wearing their scrub suits in their cars to go to another hospital. That is unacceptable. Even if you're a doctor, it's unacceptable. It's one scrub suit for one theater. You take it, put it in your bag, get another pair. It's as easy as that. Like I was saying, going back to the scrub suit issue, that is what it is, unfortunately. You cannot wear the same scrub suit tomorrow again. Please guys, don't do that. And also, if you are using the hospital issued scrub suits, please make sure that you are wearing proper underwear for the females, because I've seen a lot of things, and I think that is one of the reasons that made me buy my own scrub suits, or make my own scrub suits for that matter, because there's some gross things that happen in the change room, and some nurses just don't care. So I like to have my own scrub suit because I know that I've worn it. I have worn it. I know that it's going into the wash basket. At the end of the day, it's going to be sanitized its specific way, and when I wear it again, it's going to be clean, it's going to be ironed, it's going to be fresh. So that is the thing. So if you're wearing issued scrub suits, guys, please just wear proper underwear, because it's quite gross to see some things on the pants. I don't even want to elaborate. Let's move on from there. I'm not even going to elaborate on that. The reason why I like theater is that as a scrub sister, if you are scrubbed for the case, you are the captain of that ship for that case. Nothing happens without your go ahead. Whether you are assisting a professor or you're assisting a registrar that's on doing their rotation, or whatever it is. But at the end of the day, you set the rules, you set the guidelines, you have control of that theater for that specific procedure. And that is autonomy for me in its fullest form. Where you can say to the doctor, I am missing one swab, I'm not handing you any sutures until we find that swab. You can do that. You can do that freely, and that's what I love about it. And it just makes you a better leader. It makes you a better, I'm not saying that if you are not in theater you cannot be a better leader, please don't get me wrong, but what I'm saying is that you, as a theater scrub sister, if you are scrubbed for that case and you are well trained for that case, you have got every right to stop and go whoever you want to in the theater. If you don't want people to come into your theater, it's your prerogative. If you don't want sales representatives coming into your theater, it's your prerogative. But however, if you don't want the rep to come into your theater, then you need to know how to use whatever it is they are bringing into the theater. So that is where the catch comes in. If you are comfortable in doing spinal surgery with implants, go ahead and do it. You don't need to have extra people in your theater. But then again, guys, you've got to remember, I'm speaking for myself as Ingrid and not for anybody else out there. Also, another thing when it comes to theatre is that when your slate is done, when your cases are done, your day is done. If you are specialized in cardiac surgery, if there's no cases for the day, maybe you'll do some assisting or relieving for lunch breaks and tea breaks and all of that, and everything else. But I mean, I don't believe in being an all-rounder in one sense, and sometimes I do believe in being an all-rounder, but it depends on what all-rounder you are wanting to be in the environment that you work in. You know, there's some places where you've got your theater attached to your cath lab, attached to the x-ray department, attached to labor ward, you know, those kinds of things. So then you can multitask in that sense, and you have to have other skills to go along with it. But generally, I believe in specializing in one or two surgical disciplines and work yourself from there and become an expert in your field. Back to what I love. Theater is it for me. It will always be it for me. And I mean, I love theater. I love neurosurgery. Taking it a step further, I love neuroendovascular surgery. That is just amazing stuff that happens there. I mean, the evolution of neurosurgery in the past 20 years is phenomenal. It's mind-blowing. That's how dynamic things get with time when you're working in theater, and you're seeing these technologies that are coming in, making surgeries quicker, faster, more accurate, you know, and less invasive, as if you like to say, less invasive. That is the beauty of working in theater. And also, at this point, if you do work in a hospital and you are a medical person, please make sure that your appearance is appropriate. Make sure that your nails are short. Make sure that you look presentable every single day. Looking presentable doesn't mean you have to have a wig or a weave or a whole full face of makeup. No, you just got to be fresh and look good every day. That is all we need. Patients need to see you smiling. Patients need to see you looking fresh, and you know your game. You know what you're here to do. So with the confidence boost that you're giving your patients, you also feel good. You also look good, you feel good, you feel competent. And that will boost your day in a million ways. Try it. And with that, I hope you enjoyed this video, and I hope to see you in the next video. Please do take care. God bless. Stay safe. Bye-bye.